Hello friends, this is Dr. Sagar Bhargava. I am a cataract, refractive and a glaucoma surgeon. Now are you confused about which laser procedure to do for the power correction? This video will precisely help you in taking that decision. We all know there are four basic types of laser procedures which are available. This video we will see what are differences in between these procedures and try to come to a summary which will help you to decide which laser is best suited for you. So let's get started. Now if we go in the history to see when each of these procedures started, we find that PRK was the first procedure to get FDA approval. That was way back in 1995, followed by Lasik in 1999, followed by FemtoLASIK in 2001, and more recently SMILE. We have to understand this, that FDA approval is only possible if the clinical trial results presented to the FDA shows that the benefits offered by the procedure outweighs the risks. Before going into the comparison, let's understand in brief about what exactly is done in these procedures. Let's start with PRK. Now in PRK, the corneal epithelium is loosened using 20% absolute alcohol. The epithelium is then removed, followed by the laser application. Then at the conclusion, the raw corneal area is covered by a specialized contact lens called as bandage contact lens for a period of 3 to 5 days. In that 3 to 5 days period, the epithelium of the cornea regrows and then the lens is removed. In LASIK, using a microkeratin blade, the flap is fashioned as shown here. The flap is lifted, moved to the side, and then the laser is applied on the corneal bed. In femtosecond laser LASIK, the femtosecond laser is used to create the cleavage plane. The flap is dissected and moved to the side, and then the laser is applied on the corneal bed. In SMILE laser, which is a newer procedure, here a part of the corneal tissue is carved out in the cornea itself with the help of femtosecond laser, and this tissue, which is called as lenticule, is removed from the side cut, which is about 2 to 4 millimeters. Now what is the range of corrections of these procedures? So in PRK we can correct up to -6 diopters of myopia and astigmatism, and up to +4 diopters of hypermetropia. In LASIK we can correct up to -10 diopters of myopia and about 4 diopters of hypermetropia and about -6 diopters of astigmatism. In SMILE we can correct up to -10 diopters of sphere and -5 diopters of cylinder. The minimum corneal thickness which is required for LASIK, Femto and SMILE is 500. However, for PRK we can go in for thinner corneas up to 470 microns. So in other words, PRK can be done on thinner corneas on the recommended powers. Now as we have seen from the videos that only in LASIK there is use of blade, rest all the procedures don't need a blade. And if you look at the flap creation is done in both LASIK and FemtoLASIK, whereas in PRK and SMILE there is no flap. If we look at the incision size, as we have seen in PRK there is no cut at all. In LASIK and FemtoLASIK the cut is about 20 millimeters. SMILE, the cut is just about 2 to 4 millimeters. So it's much smaller compared to LASIK and FemtoLASIK. That is the biggest advantage of SMILE. Here is the diagram which shows the same. So SMILE is a huge advancement in terms of reducing the incision size on the cornea to a very small length. Now if we look at the intraoperative complications, PRK is the only procedure where there are no risk of complications during the surgery. Lasik can have flap related problems like buttonhole and free cap as are shown in the photographs here. Or sometimes you may have irregular cap or incomplete flap. These complications are rare nowadays, probably less than 1% of the cases, but if they do occur, the chance of abandonment of the procedure is there. In that situation, patient will have to undergo a second procedure after 3 months. Flap creation in FemtoLASIK is done by laser, so it is more controlled. So the risk of flap related complication is much lesser compared to standard LASIK. However, suction loss during flap creation can create issues. In that scenario, redocking and retreatment may be undertaken. In SMILE, an early suction loss would mean conversion to a different technique like PRK or FemtoLASIK. As is shown in this video, you can see that there is a early stage suction loss. As the laser was firing, the suction got lost, and then the patient was converted to FemtoLASIK. However, the suction loss happens towards the later part of the procedure. SMILE can still be continued. Very rarely, if there are repeated suction locks, then the surgery has to be abandoned. Moreover, in SMILE, dissection of lenticule sometimes poses a challenge, and in extremely rare scenarios, possibility of difficult lenticular dissection, lenticular tear, residual lenticule is there, which may need a second intervention later on. So if we look at the possibility of abandonment of the procedure, LASIK probably has the highest chance due to flap related issues. FemtoLASIK and SMILE can have suction loss issues which may or may not lead to postponement of the procedure. Now if we look at the level of cooperation needed from patient side, highest level of stillness and cooperation is required in SMILE and FemtoSecond LASIK compared to LASIK and PRK. When we talk about discomfort, here patients who have PRK have significant discomfort, pain, watering, light intolerance for almost 2 to 3 days, because that is the time when the epithelium is regrowing. The other 3 procedures may experience discomfort for first few hours, but the next day onwards they are quite comfortable. Now if you look at the vision improvement, this is seen very next day in LASIK and FemtoLASIK. SMILE vision improvement may take anywhere between 1 to 7 days, whereas PRK is slowest in terms of vision improvement and will take about 2 to 4 weeks. Now dryness is an issue which is mainly with LASIK, as flap creation cuts the corneal nerves, which leads to dryness for a period of 3 to 6 months. In SMILE, corneal incision is very small as discussed, so corneal nerves are relatively spared. PRK, there is no cut in the corneal structure, so the chance of dry eye is very less. This point is reiterated in this paper, which essentially takes into account studies on dry eye after laser refractive procedure. It clearly says that patients who have undergone PRK and SMILE, the chance of dryness is much lesser compared to LASIK or FemtoLASIK. Another query that the patients have is, what happens if I sustain a direct injury to the eye? Where in LASIK there is a risk of flap displacement which would need surgical intervention to rectify. In SMILE and PRK there is no issue with direct injury to the eye, as these are flapless procedures. Outdoor sports in case of SMILE can be resumed even after 3 or 4 days. PRK also, one can resume outdoor activities after removal of the contact lens. But in LASIK we advise at least 2 weeks of deferment of sports activities. In the long term, if we compare the strength of the cornea, PRK treated corneas are the strongest, followed by smile eyes and followed by the LASIK treated eyes. Next we look at risk of ectasia. Now what is ectasia? Ectasia is nothing but a dreadful complication of any laser refractive procedure, which basically means there is a protrusion of the cornea as the corneal structure is weakened and is unable to maintain its structure. This leads to a reduction in the vision. Patient will have to go back to glasses, contact lenses, and sometimes additional procedures like collagen cross-linking may be needed. Now incidence as shown here, PRK treated corneas are the strongest. So ectasia incidence is less compared to LASIK. Smile being a new procedure, the exact incidence right now is not known. Now this is the table which sums up all the points which we just discussed. So if we were to give a snapshot of each procedure, then PRK is a procedure that can treat low errors up to -6 diopters and can be done on relatively thinner corneas. It has no risk of intraoperative complication, but will have 2 to 3 days of discomfort and delayed visual recovery. However, its biggest advantage is that any form of post-op injury will have no issues as there is no flap involved. LASIK or FemtoLASIK is a procedure which has proven track record of more than 20 years, but it comes with a slight risk of intraoperative complications. It gives a very fast visual recovery and giving a wow effect the very next day. Unlike PRK, one has to be more careful in the post-op period because any significant injury will lead to flap related issues and patient will need a repeat OT visit to rectify the flap issue. Smile is more recent innovation, which is a flapless procedure and creates a very small cut on the cornea, but it does have a small risk of intraoperative complication. It gives faster visual recovery compared to PRK but slower than LASIK. Its biggest advantage is that patients are able to resume their activities within 2 to 3 days, and the risk of complication following an injury are not there as there is no flap. I hope this video explains you all the pros and cons of the presently available laser refractive procedure and will help you in making a right decision for your eyes. I hope this video is useful to all of you. Thank you so much.